Hi, everyone. This is Felicia Brown with One Concept Radio, where I'm getting to know experts and educators from the massage, chiropractic, acupuncture, and spa professions. Today, I'm here with Dr. George Roth. Dr. George Roth is the developer of Matrix Repatterning. He has been in practice since 1978 and is recognized worldwide as an authority in the treatment of musculoskeletal and structural disorders. He is the co-author of Positional Release Therapy, Assessment and Treatment of Musculoskeletal Dysfunction, and the author of the Matrix Repatterning Program for pain relief. Welcome, Dr. Roth.
Well, thank you very much, Felicia. Nice to talk to you again, and appreciate the opportunity to share some of my information with your listeners.
Fantastic. Well, we're excited to have you as a part of the One Concept conferences, and I'd like to talk to you about a few different things leading up to your class that's starting in October, just a couple of days away, really. We're going to be sharing the stage here and there at the One Concept Canadian Massage and Chiropractic Conference in Niagara Falls. Getting started with that, one question that I've been talking to a lot of our speakers and presenters about is the idea of wellness and trying to get a sense of how people think about wellness or how they define it. So I'm wondering, how do you define wellness?
Well, I guess I would define wellness as an inherent expression of life that is the ideal state in which we all aspire to, in which we all, I believe, start out in life. And I'd say it's a state of functional balance, which encompasses body, mind, and spirit. And it allows the essence of well-being that's inherent in us to flow freely.
Well, I've heard a lot of things in there about that well-being, and I really like the term that you use, functional balance, because it is about everything being able to work, but being in, I guess, symbiosis with each other, one system to the next, one part of our lives to the next.
Yeah, it's that state of balance. I think that's the key, and believing that this is something that is natural and expected. I think there's so much promotion of fear and worry around disease, and the disease focus has been part of our conditioning in our culture for so long that as health practitioners, it's our job to really support the idea of wellness and express that in every interaction we have with our patients.
Well, I love that thought of expecting health and really trying to get people caught up in the idea of the intention or the idea creating that health in the body. And I know that perhaps in a way part of what you talk about in Matrix Repatterning is about creating that health. I wonder if you could just explain before we get into the class that you'll be teaching in Niagara Falls, if you could just explain what Matrix Repatterning is for the people listening.
Sure. Well, Matrix Repatterning is a gentle form of manual therapy, but the basis of it is really locating the source of restriction, which is really just areas of the body that impede the natural flow of well-being, which is one way of looking at that is the movement of energy. But energy is now, we now know to be measurable in the form of electrical current, and our bodies are basically batteries, and so when there is resistance or restriction, that electrical current is impeded, and that's actually something that we can detect with a very simple assessment procedure that we've developed, and it can precisely help us locate where those areas of restriction are, because essentially most manual therapists recognize restriction is the problem, but what causes it? Where is it coming from? And more of the cellular research is showing us that there's a real basis, a scientific basis for understanding how cells generate this energy, which is electrochemical in nature, and that when it's impeded, there's a diminishment of health and a loss of vitality and cellular impairment. And but it actually is detectable. Many people can pick it up intuitively, but I feel it's important for anyone to be able to detect that, and that's something that can be done in a very objective way which even if you don't have the intuitive ability to locate these areas, it is possible through our procedures to be able to detect the source of those areas. So that's number one. Secondly, once we find them, what do we do about it? Well, treatment is very, very gentle. It's really just gently encouraging and essentially almost whispering into tissue in order to reestablish that movement of energy, which is really what, to me, health is about, because well-being is an expression of that vital force, which you can call energy or you can call electrical current, and that is what we try to do with matrix repatterning. So locating the problem, number one. Number two, gently encouraging the reestablishment of that movement through the body in order to allow the body to heal itself, really, because we don't do the healing. The body is capable of healing itself, but when those restrictions are present, then the body is challenged and unable to access the areas that have been affected.
Now, I'm not sure if this is an appropriate question or not, but as I'm listening, my mind is, the wheels are turning. So when you have a restriction in an area, would you say that it's more likely that the restriction is causing the energy imbalance or that the energy imbalance is causing the restriction?
Yeah, it can be either or, because energy imbalance can be caused by mental states, emotional states, chemical imbalance, as well as injury to tissue. And so you can have, one causing the other and vice versa. So energy restriction creates restriction, and restriction causes the energetic imbalance as well. So to me, it's all one thing, and it's really just a matter of whether or not we can locate it, and if it's appropriate to the approach which manual therapy can address. But in some cases, for many people, if they're under a lot of stress, it may be teaching them simple breathing exercises or relaxation exercises, or improving their diet. There's so many aspects to what impedes the natural flow of well-being in the body. So we have to recognize when it is something that is appropriate to the physical intervention or other forms of intervention that may be required.
Right. And, I've had the pleasure of actually experiencing both being in your class and having some hands-on work from you. So I know a little bit about what goes on there. But I'm wondering, I've heard you talk about people being intuitive and being able to locate these restrictions, or there being other ways to determine them. Can you share some of what you might be teaching in the class in terms of
Sure.
Of that?
We have what we call a global assessment. So by applying a normalizing field to the body, and that can be done, for example, let's say you bump your elbow or you bump your knee. I often ask people, what's the first thing you do? People say, I say, ouch, I withdraw my arm. No, what you do is you grab it, you hold it, you put your hand on that area. And one of the thoughts is that, we're producing electrical energy through our tissues, and one of the ways that's expressed is through the nervous system. And the hand is fairly unique in that it's a very high concentration of nerve endings, and therefore it produces a fairly strong electrical field. And the electrical field, when it's applied to an area of the body that's injured or impaired in some way, will have a normalizing effect. And one of those effects is it causes the area to relax. And that relaxation of tissue is something that we use to be able to detect the presence of what we call a restriction, or we call it a primary restriction, which is a source of injury. We've also developed some instruments that also can provide that normalizing field, which we can use to precisely locate these areas as well. So essentially it's an electronic intervention, either through the hand or through an instrument, to all areas of the body, and then using a process of detecting changes in tension, which are caused by that, it can help us locate precisely those areas of restriction, which can lead us to the area that needs to be treated.
Well, listening to it, I'm thinking, I know what you're doing. I've watched you do it, and I've had you do it, but you got to be in the class to really get it. It's a really fascinating process to watch, and I think that people that come to your class are really going to be blown away by how much they can detect and feel that maybe they never really knew was there.
Right. And I think also one of the recognitions with our work is I've been searching over many years, and over 35 years in practice now, and Matrix Repatterning is really the culmination of sort of my search for some physical intervention with the way the body works. And one of the things that we've found is that many of these restrictions are very deep inside the body and in the core fascial structures, things like the actual skeletal frame and deep within the internal organs. These areas are unique in that they're very dense because of the density of bone, or the organs themselves, which are fluid-filled, water itself being very dense. This is where many injuries actually manifest. And I think that these are areas that are often not recognized as being potential areas of musculoskeletal imbalance or even pain. And we have found that by locating and treating injury at that level, we're able to change things in a very profound way. And but in fact, it's also very gentle. It doesn't require a lot of force and repetitive treatment once we locate those areas as well.
Well, it's a fascinating technique, and I definitely encourage people to come to the class and try it out, and maybe find a way to have a demo with you. I know you'll be doing some of those perhaps in the community room and maybe at your booth.
For sure.
With the people listening, we always like to try and give them something that they can use right now. So I'm wondering if you have a tip that you can offer for massage therapists and other wellness professionals, either to improve their results with clients and or improve their level of professional success. I guess they really go hand in hand. But anything you'd like to share?
Sure. A couple of things. Well, I think for me over the years, I've tried to come to terms with, how can I set myself up for success when I'm approaching an individual. And in general, when I think about the kinds of conditions that are often presented to us in our offices, and I think it's really essential for us as health professionals to align ourselves with really developing a greater understanding and really a belief in the inherent well-being that's the basis of life, and really believing that is available, and accessible. And I believe that by focusing on the well-being that's present, recognizing that anyone who walks into our office, mostly they're going to be healthy. We're not in a hospital. We're not, amongst people that are dying. Some of us are, of course. But even then, there's so much well-being that's present. And I believe that by focusing on the well-being that's present, we can accentuate that. And we have to remember that we're health practitioners and not disease practitioners, and that we create what we focus on. So if we focus on the well-being, we'll be able to energize that and support that potential within ourselves and with everyone we encounter. And I think with Matrix Repatterning, because it's a very gentle approach that really helps the body to reconnect to that well-being, it's something that when people actually feel the effects of it, even during treatment, it's actually quite profound for many people because they immediately feel that flow of energy in their body. And one of the things we have on our website, which might be of benefit to consider, there is a video in which I demonstrate some self-treatment. And so any practitioner, anyone in the public can go there and have a look at that on our website. And I do a presentation on treating, for example, the lower extremity for yourself. And that's something that will allow your listeners to actually experience some of this sense of how it feels to experience the treatment that we provide in Matrix Repatterning. And it's something that many people can apply for themselves and improve their own bodies. So in my book, the Matrix Repatterning Program for Pain Relief, I also present a number of ways to access that as well.
I was just going to mention that because I've read that book, and it's a great resource for people that want to learn more about that. Dr. Roth, we want to make sure people can find that book and the video clips. Can you share the best contact information or the website address with everyone?
Yeah, the website address is www.matrixrepatterning.com. And the other question you had was the book, or
well, I want to make sure that people can find the book if it's if it's on.
Well, it's the Matrix Repatterning Program for Pain Relief, published by Harbinger Publications, and it should be available through any bookseller, Barnes & Noble or Amazon or Chapters in Canada. So it's available through any bookseller. And just wanted to share with you also, there's a big topic of discussion these days is concussion and head injury, and that's an area that we're currently doing some research in for the past several years. And so that's something that hopefully next year we will be publishing. There's a brain specialist who's actually been monitoring some of our cases, and we'll be publishing some material on this next year. So we'll keep you posted. Just stay tuned to our website. We'll let you know when that's coming available.
Fantastic. Well, that's exciting news, and I know it'll be definitely in demand with all the focus that there's been on that and all the concussions that are out there. Well, we're very excited, Dr. Roth, to have you coming back to the Canadian Massage and Chiropractic Conference, and I thank you so much for making time to speak with me today and share this preview of your information on today's broadcast.
It's been my absolute pleasure. Nice talking to you again, Felicia. Take care.
Likewise. And for everyone listening, if you'd like to learn more from Dr. George Roth, please join us for the One Concept Canadian Massage and Chiropractic Conference in Niagara Falls, Ontario, October 18th through 20th. Just go to www.oneconcept.com. That's the word one, O-N-E, concept.com for more information and to register. Thanks so much for tuning in, and have a fabulous day.